Hospital cleaners play a crucial role in maintaining hygiene and infection control within healthcare facilities. They ensure that patient rooms, operating theaters, waiting areas, and other hospital spaces are sanitized and free from contaminants. The cleanliness of a hospital directly impacts patient safety, recovery, and overall health outcomes, making the role of a hospital cleaner vital to healthcare operations. Employers look for candidates who are diligent, reliable, and detail-oriented. A successful hospital cleaner combines knowledge of cleaning techniques, infection control protocols, and safety measures with strong organizational skills and physical stamina. This video provides common interview questions for hospital cleaner roles, sample answers, and practical tips to help candidates demonstrate their reliability, professionalism, and understanding of healthcare cleaning standards. Understanding the role of a hospital cleaner. A hospital cleaner is responsible for maintaining sanitary conditions throughout the healthcare facility. Their duties include disinfecting surfaces, cleaning patient rooms and wards, emptying bins, restocking cleaning supplies, and handling specialized cleaning equipment. They also adhere to strict infection control protocols, ensuring that all areas meet healthcare hygiene standards. Employers value candidates who understand the importance of hygiene, can follow detailed cleaning procedures, and maintain safety in a high-risk environment. The role requires physical endurance, attention to detail, organizational skills, and knowledge of hospital cleaning standards. Preparing for interviews involves highlighting experience in cleaning, knowledge of infection control, safe handling of chemicals, and the ability to manage multiple tasks efficiently. Question 1. Why do you want to work as a hospital cleaner? Here's how you can answer. I want to work as a hospital cleaner because I understand the critical role cleanliness plays in patient safety and recovery. I am dedicated to maintaining hygienic environments and contributing to the well-being of patients and staff. Tip: highlight your dedication to hygiene, responsibility, and understanding of the hospital environment. Question 2. How do you ensure safety while cleaning in a hospital? Here's how you can answer. I ensure safety by following hospital protocols, wearing appropriate personal protective equipment, using cleaning chemicals correctly, and being alert to potential hazards. I also make sure that areas are clearly marked if wet or potentially unsafe to prevent accidents. Tip: emphasize knowledge of safety procedures, vigilance, and adherence to hospital protocols. Question 3. How do you handle cleaning tasks in high-risk areas, such as operating theaters or isolation wards? Here's how you can answer. I handle high-risk areas by strictly following infection control procedures, using hospital-approved disinfectants, and wearing the necessary protective gear. I pay close attention to detail and ensure that all surfaces are thoroughly sanitized to prevent the spread of infections. Tip: highlight knowledge of infection control, attention to detail, and safety awareness. Question 4. How do you manage cleaning multiple areas efficiently? Here's how you can answer. I manage multiple areas by planning my tasks based on priority and urgency, using a systematic approach, and working efficiently without compromising quality. I also communicate with colleagues to coordinate cleaning schedules and ensure that high-traffic areas are maintained regularly. Tip: emphasize organizational skills, time management, and teamwork. Question 5. How do you deal with biohazardous waste? Here's how you can answer. I handle biohazardous waste by following hospital procedures for segregation, containment, and disposal. I use protective equipment, label waste appropriately, and ensure it is collected by authorized personnel for safe disposal. Tip: highlight knowledge of biohazard protocols, safety, and responsibility. Question 6. How do you maintain cleaning equipment and supplies? Here's how you can answer. I maintain equipment by checking it regularly, cleaning it after use, and reporting any faults or malfunctions. I keep cleaning supplies organized, restock them when necessary, and ensure that chemicals are stored safely and labeled correctly. Tip: emphasize responsibility, organization, and attention to equipment maintenance. Question 7. How do you ensure that all surfaces are clean to hospital standards? Here's how you can answer. I ensure surfaces are clean to hospital standards by following specific protocols, using approved disinfectants, and paying extra attention to high-touch areas such as door handles, bed rails, and switches. I also perform routine checks to confirm that cleaning standards are met consistently. Tip: highlight attention to detail, knowledge of hygiene standards, and commitment to quality. Question 8. How do you handle complaints about cleanliness from patients or staff? Here's how you can answer. I handle complaints by listening carefully, assessing the issue, and taking immediate corrective action. I also document the complaint and notify supervisors if necessary to prevent similar issues in the future. Tip: emphasize responsiveness, problem-solving, and dedication to maintaining standards. Question 9. How do you protect yourself from infections while cleaning? Here's how you can answer. I protect myself by wearing personal protective equipment such as gloves, masks, and aprons, following hand hygiene protocols, and using cleaning chemicals safely. I also follow hospital guidelines for handling contaminated materials and maintain awareness of potential hazards. Tip: highlight safety awareness, knowledge of infection control, and adherence to protocols. Question 10. Why should we hire you as a hospital cleaner? Here's how you can answer. You should hire me because I am reliable, detail-oriented, and experienced in maintaining high standards of hygiene. I understand the critical role cleanliness plays in healthcare, follow infection control procedures rigorously, and work efficiently while ensuring safety for patients and staff. Tip: summarize key strengths, focusing on reliability, attention to detail, safety, and commitment to high hygiene standards. Final thoughts. Hospital cleaner interviews assess attention to detail, hygiene knowledge, safety awareness, and the ability to work efficiently in a healthcare setting. Candidates should prepare structured answers, provide examples of their experience, and demonstrate their understanding of hospital cleaning standards. Employers seek professionals who are reliable, proactive, and capable of maintaining safe, clean, and hygienic environments. By emphasizing attention to detail, safety awareness, organizational skills, and infection control knowledge, candidates can demonstrate readiness for the hospital cleaner role. Highlighting the ability to handle biohazardous materials, maintain equipment, and respond to feedback ensures that you are seen as a competent and dependable professional. Thorough preparation for these questions enhances both interview performance and long-term effectiveness in maintaining high standards of cleanliness in hospitals.